Hi, I'm Gil Kerlikowske, Director of National Drug Control Policy. Well, I'm sorry I cannot be with you in Portland, but on behalf of the Obama administration, I want to thank you for your work. And I'd like to take a moment to discuss steps we can take together to reduce drug use and its consequences. First, I want to thank each of you for your commitment to addressing the drug problem in America. You work hard every day to help others, and like many others across America working on the drug issue, you do it with little or no recognition. So on behalf of this administration, thank you. As all of you know, drug overdose deaths represent a serious public health emergency in America. According to the CDC, there are about 100 overdose deaths every day in this country. Remarkably, drug overdose deaths now outnumber deaths from gunshot wounds or from car crashes. And as policymakers, we have a responsibility to respond to this challenge in a holistic way. This urgency is what drives our administration's work to reform drug policy. Drug policy should be considered a public health issue, not just a criminal justice issue. And those who suffer from substance use disorders should never be stigmatized, tossed aside, or considered beyond helping. And science, not dogma or ideology, should drive our policies. We're serious about this commitment to reform, and that's why this summer we visited Project Lazarus in North Carolina to highlight the role naloxone plays in reversing overdose and set a national goal of reducing overdose deaths. That's why, despite subsequent action by Congress, this administration lifted the ban on federal funding for needle exchange after a decade of inaction. That's why the President signed the Fair Sentencing Act into law, which addressed the long-standing and disparity in sentencing for crack and cocaine. And that's why we worked so hard to pass the Affordable Care Act, which, for the first time in history, requires insurance companies to treat drug addiction the same way they would any other disease. But this isn't enough. We must do more, and we must work together. There are some who will seek to divide us by focusing on where we disagree. But for the sake of progress, we must find more ways to work together instead. Proactively supporting the use of naloxone and needle exchange is a major milestone for us. At the same time, I hope you will join us to support other innovative efforts. Programs like screening, brief intervention, and referral to treatment enable doctors to recognize and treat substance use early before it becomes a more serious problem. Evidence-based programs like our National Youth Anti-Drug Media Campaign use advertising to encourage people to make healthy decisions and reject drug use in the first place. And programs like drug courts refer nonviolent offenders into treatment instead of prison. Well, I'm proud to be the first director of National Drug Control Policy to address the Harm Reduction Conference. And I hope you share my optimism about how we can work together. At the end of the day, we are all trying to build a healthier and safer America. Thank you and best wishes for a successful conference.